So I'm here with Mark Sugrue, and he is with PricewaterhouseCoopers, and he was on our panel today, and I'm going to ask him a few questions. So thank you for being here today. What impressions did you have of our summit today?
Thanks, Debbie. I think the summit was fantastic. It was an amazing experience to be sitting on the panel and really learn from the other panelists about some of the key issues that are facing organizations today. I was particularly interested in the great discussion and dialogue we had around the architecture and the whole idea of creating an environment of care that serves patients better than what we have currently in many of our organizations across the U.S. and the globe.
So in your role today, you're working with clinicians across the country. What are the challenges that you're seeing today as far as adoption and wireless and those type of technologies?
Great question. There are a lot of challenges in many organizations with adoption of technology. I think the biggest challenge that many organizations face used to be money, used to be economics. Do we have enough money to buy the technology that we need? The government has stepped up and has really been promoting the adoption of technology and has included incentive funding. So that really is no longer the number one challenge. From where I sit, the number one challenge is interoperability. The vendors that provide technology solutions for healthcare organizations today really lack the ability to integrate their solutions across multiple platforms. And the outcome of that is that we have an environment of care that is very disparate and separate from a technology standpoint. As a clinician, I'd like to see us have better integration and interoperability between the various technologies that we offer.
Well, I know, being a nurse myself, that nurses are great at workarounds and trying to take care of their patients as best as they can. Some nurses feel like the technology is a hindrance.
Yes.
What are your thoughts on that?
Absolutely. There's no better community of individuals to find workarounds than nurses. I think nurses work from their heart and take care of patients first, and won't let anything, even technology, get in their way. And it's really not the nurse's fault. Sometimes when the technology is implemented, it is implemented on top of poor processes to begin with. And that's really not a viable solution. We really need to be thinking about how technology can support the best practice or leading practice for care delivery. And oftentimes that's just not the case. In fact, sometimes the technology is put in and the practice is modified to meet the technology needs. And that's not right either. We really need to figure out how to make the best practice enabled by technology. And then we won't have the issues of workarounds and unintended consequences that come with those workarounds.
Sure. So where do you see healthcare in the next 5 to 10 years?
I'm really excited for the next 5 to 10 years, Debbie. It's an amazing time to be in this industry, and I'm very fortunate to be at a point in my career where I can be in a leadership role. I think what I see in the next 5 to 10 years is the continued convergence of data across multiple platforms. I'm particularly excited about the wealth of data that we've got coming through genomics and the genomic research in personalized medicine. I think we'll get our electronic health record data. We're going to get data from patients and families coming through personal health records. We've got data coming from the payers and the pharmaceutical industries. And then on top of all that, we're going to be able to put genomic data on our data set. And I think it's going to tell us some amazing things, and we're going to learn a lot in the next 5 to 10 years.
Well, thank you, Mark, for being with us today.
Thank
we really
you.
Appreciate it.
Thank you, Debbie. Pleasure.
All right.